Have you ever heard about leishmaniasis? Probably not, because it's a neglected tropical disease affecting the poorest people around the world, those who live in the most remote areas with little or no access to health care. But visceral leishmaniasis is the second largest parasitic killer in the world, killing tens of thousands of people each year. It is transmitted by sandflies, and it gives different clinical presentations, ranging from different skin infections to infection of internal organs where spleen and liver are heavily loaded with parasite, and this infection is lethal within months without proper treatment. For decades, only highly toxic drugs with painful routes of administration were used in treatment of leishmaniasis. A lot of patients could not bear these side effects, and they would actually discontinue the treatment. But today, a drug called miltefosine is the first oral drug available for treatment of leishmaniasis, and we have seen that it's actually better tolerated and safer to use. My doctoral research focuses on this drug with an ultimate clinical goal to develop and deliver safer and more effective treatment options for leishmaniasis. In clinical studies, we have seen that miltefosine is actually less effective in children compared to adults. And this is because children have a lower concentration of the drug in their blood compared to adult patients. Our first focus was to figure out what was the reason causing these differences in treatment response between different patient populations. Here we applied advanced methods of modeling and simulation to develop more precise dosing. And we have actually shown that in order to reach cure, although not intuitively, a child needs to receive a higher dose compared to an adult patient. Secondly, with the older drugs that were used in treatment of VL, we see that some patients develop chronic skin rash. Now, this is not life-threatening. However, a parasite in the skin is more easily transmitted than a parasite that is localized in spleen or liver. So the second focus was to figure out how does one actually develop an infection in the skin after presumably being successfully treated for an infection in the internal organs. Our hypothesis is actually that this is likely not going to happen if a patient is treated with miltefosine due to higher efficacy of the treatment. Finally, we show that not all patients can be treated in the same way. And I'm not talking about just selecting the right drug, but also giving the right dose, because one size certainly does not fit all. And in order to reach cure in different patients, we need to apply precision dosing.